Good afternoon, everyone. Thanks for joining us. As you can see, I'm joined today by the Chief Medical Officer and the National Clinical Director. Throughout this pandemic, and particularly at key stages of it, we have tried very hard to be open and upfront with you about the challenges and the uncertainties confronting us so that you can better understand, if not always agree with, I accept, the difficult judgments and decisions that we have had to make. I'm afraid this is another moment when such frankness is really important. The purpose of today's update is to level with you on what we know so far about the spread in Scotland of the new Omicron variant, and also to share our estimate at this stage of what we're likely to face in the days and weeks to come. The fact is that we do face a renewed and a very severe challenge in the face of the new Omicron variant. To be blunt, because of the much greater and faster transmissibility of this new variant, we may be facing, indeed, we may be starting to experience a potential tsunami of infections. Now, we're not alone in that, far from it. Everything I'm about to share with you about the situation in Scotland is, I believe, broadly reflected in the data for the rest of the UK too. And although I'm not familiar with the data elsewhere, I would suspect it is reflected there too. However, we have just published an evidence paper which seeks to provide you with more detail about the Omicron variant here in Scotland at this stage, and you can find that evidence paper online on the Scottish Government website or Twitter feed. Now, I'm going to come back to more detail in that and to tell you what we do know about and what we expect from Omicron, and I'll do that shortly. Firstly, though, as I usually do, I'm just going to briefly summarise today's statistics. 5,018 positive cases were reported yesterday, which is 9.3% of all tests carried out. Now, this is one day's figures, but as you can see, it is a sharp rise on the average of around 2,800 per day that we have been reporting recently. And it underlines our fear that a new wave may indeed be starting. 573 people are currently in hospital with COVID. That's 5 fewer than yesterday, and 40 people are in intensive care, 1 more than yesterday, although I would remind you that there is always a time lag between rising cases and rising numbers of people in hospital and intensive care. And sadly, a further 19 deaths have been reported in the past 24 hours, and that takes the total number of deaths under the daily definition to 9,707. And I want again to send my condolences to everyone who has lost a loved one. I am pleased to report, though, and this is important and will become increasingly important in the weeks to come, that the vaccination programme continues apace. 4,358,725 people now have a first dose. 3,967,477 are now double dosed, and we have also now very significantly passed 2 million booster or third doses administered in Scotland. To be precise, 2,915,000. On first, second, third and booster doses, Scotland is still the most vaccinated part of the UK. And again, I want to record my thanks to everyone involved in organising and delivering this vaccination programme. Without a doubt, the biggest peacetime logistical exercise that has ever been undertaken in Scotland. Now, in relation to the Omicron variant specifically, as of 5 p.m. yesterday, there were 110 confirmed cases in Scotland. And to give some context to that, 10 days ago, we reported a total of 9 confirmed cases. Now, these are confirmed cases, and by that we mean that Omicron has been confirmed through genomic sequencing. But there are 2 reasons why confirmed cases represent just the tip of the iceberg and shouldn't really be looked at as the best indicator of the true prevalence of the variant in Scotland right now. The first reason is because genomic sequencing takes some time, much longer than processing a PCR test. So there is a time lag in these figures. But secondly, while in Scotland we do a lot of genomic sequencing, not all tests are, or indeed can be, analysed in that way. So a much better indicator of whether a case is Omicron or not is whether the PCR test shows a specific genetic characteristic known as the S gene dropout, and you may have heard us talk about that previously. Now, around 95% of all tests in Scotland are analysed in a way that allows us to know this, and almost all tests that do show the S gene dropout just now will be the Omicron variant. So these figures help to give a much better sense of the true scale of the variant in Scotland at this stage. And what they show is that Omicron right now is rising exponentially. Indeed, what we are seeing in the data just now is perhaps the fastest exponential growth that we have seen in this pandemic so far. In the final week of November, if we look at all of the COVID cases recorded in Scotland, there were no days when the proportion of cases with the S gene dropout was higher than 1%. However, by last Sunday, the 5th of December, the proportion had risen to 2%. On Tuesday, it was just over 4%. On Wednesday, it was almost 7%. And today, it is 15.5%. Now, you might think, well, these are still relatively low percentages, but consider that trend. This is doubling on a very, very rapid basis. Indeed, our estimate at this stage is that the doubling time for Omicron cases is between 2 and 3 days. And actually, it may be closer to 2 days than to 3 days. Now, if that continues, and we have no reason at this stage to expect that it won't, Omicron is going to very quickly overtake Delta as the dominant strain in Scotland. Indeed, I think we can now say with some confidence that we expect it to overtake Delta within days, not weeks. We estimate this may be as early as the very beginning of next week. Now, you might be asking, why does that matter? And it matters because Omicron has a much higher R number, a higher transmissibility than the Delta variant, which for some time now has been the dominant strain in Scotland and much of the world. So the R number in Scotland in recent weeks has been hovering around 1. We always like it to be below 1, but hovering around 1 is not the worst place to be. And of course, we've been seeing a decline in cases in Scotland in recent weeks. However, the R number associated with Omicron is likely, we think, to be well over 2 and possibly closer to 3. And as and when Omicron becomes the dominant strain, as it is in the process of doing, the R number associated with it will then increasingly become the R number for Scotland as a whole. So as a result, our estimate is that the R number overall in Scotland is likely to rise and possibly to rise above 2. Now, all of these estimates are based on the limited data that we already have here in Scotland, and we have been analysing that closely, but also other data available from South Africa and elsewhere. And what it all means is that in our judgment right now, it isn't any longer a question of if we are facing a surge in cases. We now believe that to be virtually certain. Our health protection teams are working really hard through contact tracing, testing and isolation to slow the spread of Omicron cases. And I want to thank them for the excellent work they're doing and everybody across the population who will be following their advice. But the nature of transmission and the nature of a variant that is even more transmissible than what has come before means that we do expect to see a rapid rise in cases in the days and weeks ahead. This is driven by the transmissibility of this variant. Figures we're seeing here in Scotland are consistent with data from around the world, and they provide a considerable degree of certainty that Omicron is significantly more transmissible than the Delta variant. The best expert advice at this stage also tells us that Omicron is more capable of reinfecting people who have had the virus previously. And based on preliminarily laboratory trials, the best evidence suggests it can evade to some extent the immunity conferred by vaccination. Now, and I want to triple underline this point, that does not mean that the vaccines will not significantly help us. Being less effective is not the same, nowhere near the same, as vaccines being ineffective. And booster doses in particular will help retain a higher level of vaccine efficiency. So getting your vaccines, including your booster, remains absolutely crucial. Now, the thing we don't know yet is whether Omicron cases cause more or less serious illness than the Delta variant. However, there is an absolutely crucial point that we all need to understand, and it's one of the most important points I need to set out today, because it is a matter of basic and quite brutal arithmetic. Even if the variant is generally a little bit less severe for most people, and let me stress, we still don't know if that is the case, but even if it is, and we certainly hope it will be, for some people it will still cause serious illness, hospitalisation, and tragically some people will die. But the overall impact point here is that even if a smaller percentage of people overall than is the case for Delta require hospital treatment, a small percentage and a smaller percentage of a bigger number will still result in a massive number of cases who might need hospital care. And given the volume of people who could be infected by Omicron because of its greater transmissibility, even if most of those cases are mild, the number of cases of serious illness amongst those infections will put massive strain on the ability of the NHS to cope. Also, the numbers of people becoming infected even mildly and having to isolate will put a significant strain on the economy and on critical services. And we're actually starting to see this already. I can tell you that today there are 60 ScotRail cancellations due to staff shortages, and these staff shortages are mainly due to COVID. And as you might have seen in the media already today, many staff at an accident and emergency unit in Lanarkshire are having to isolate through no fault of theirs, incidentally, after attending a social event and becoming infected. So all of this means that Omicron, I am afraid, is an immensely concerning development, even if it does prove to be slightly less severe than Delta. It's concerning for Scotland, for the UK, and indeed for the world. And I wanted to set this out to you today, not to try to scare people, but to provide the context for the difficult decisions that all governments might have to take in days to come, and to do what I have always tried to do, level with you and try to share the rationale for those decisions. We in the Scottish Government will be considering our next steps very carefully, but also mindful in the face of this virus, particularly a more transmissible variant, of the need to act quickly. We'll be discussing matters on a four nations basis too. I'm very mindful that anything we do, including some of what I am saying today, has an economic and a financial impact for businesses. And UK funding arrangements mean we have no choice but to look to the Treasury to act. And that's a point I'll be raising again with the UK government in a COBRA meeting later this afternoon. It is worth noting, though, as I illustrated a moment ago, that not acting will also have a financial and economic impact as more people get infected and have to be away from work. But the impact of not acting will be less managed and therefore potentially more damaging. Now, I will keep you and obviously Parliament fully updated in the days ahead. But there are 2 points I want to briefly make today before I conclude. And the first is in response to advice I received last night. Given that Omicron is now becoming dominant, our response to it has to become more general, because it will quickly be the case that most people who have COVID have the Omicron variant. And we must do all we can in that context to break the transmission chains. Therefore, from tomorrow, our advice will be that all household contacts of any confirmed COVID case should isolate for 10 days, regardless of their vaccination status, and even if they initially get a negative PCR test. I know that this is not easy, and we will obviously keep it under review. We will also ensure careful exemptions for critical services, but we believe this to be essential at this moment to help slow transmission. Non-household contacts should continue to isolate pending a PCR result. If that is negative, they can leave isolation at that point as long as they are double vaccinated. And secondly, I want to refer to the advice that Public Health Scotland made public late yesterday afternoon, that people should think about deferring work Christmas parties. Now, this is not easy advice to give or to hear, but it is incumbent on public health experts to set out very clearly and frankly the risks we face, and it's incumbent on me and government to pay attention to that advice. There is a significant risk with Omicron. and we are already seeing the reality of it, of Christmas parties or events with lots of people becoming super spreaders. And if that happens, lots of people get infected. And if these are work events, as well as the risk to individual health, there is a risk to the ability of the workplace to operate as people have to isolate. And I've already cited the train cancellations and the accident and emergency unit in Lanarkshire as examples and illustrations of that. So the public health advice, which I have no alternative but to agree with, given the evidence of risk that I know about and have now shared with you, is that we should all think a bit more carefully about unnecessary contacts, especially in crowded places just now, and that it would be sensible to defer work Christmas parties. Now, I know this has a big impact on businesses, which is why we are considering and pressing the UK government on financial support. But once again, we face a situation that frankly has no easy options. We know that any additional protective measures will cause social and economic harms, especially after almost 2 years of this pandemic. But we also know from past experience that early action is often needed when dealing with this virus. In fact, acting early is often the best way of acting proportionately. So we can't rule out further measures, and I'm afraid we can't avoid the advice that I have shared with you today. I'll continue to do all I can to be upfront and open with you in the days ahead, and I continue to be so grateful for the responsibility the vast majority of people across the population are showing. For now, though, I will end with a plea to abide by all of the current protections that we have in place. It's more important than ever. In fact, doing that still gives us the best chance we have of minimising the need for any further protections. So I want to stress once again what those current protections are. Firstly, please get vaccinated. What I've set out to you today is grim to hear. I understand that. But vaccination, even with that, means we are in a better position than last year and a better position, vastly better position than we would be without it. So please get your vaccination, first, second, third or booster dose as soon as you are able to. It's the single best thing we can do. And it's not too late if you haven't done that already. Secondly, test yourself regularly and often. If you're going to meet other people, then test yourself before you do so. If you're asking someone round to your home, or if you're meeting someone for lunch or a drink, test yourself and stress the importance to the people you're meeting of them doing the same. Do that even if you're going out for Christmas shopping. The evidence we have suggests that lateral flow tests are as effective at identifying COVID for Omicron cases as they are for Delta cases. So that means they are a hugely important way of helping us find out whether we might have the virus, especially if we don't have symptoms. So if we take these tests before we go, and if we're positive, if we isolate and get a PCR test, we significantly reduce the risk that we then pass the virus on inadvertently to others. You can get LFD devices online, NHS Inform, they'll be mailed to your home or get them from a local pharmacy or test centre. They're easy to get, they're going to be made available in other places over the next period, shopping centres, garden centres, for example, but they're already easy to get and they are easy to use as well. And finally, please comply with all of the other basic protections. It's more important than ever that you're wearing your face covering on public transport, in shops, and when moving about in hospitality. Keep windows open when you are meeting people indoors. Don't get me wrong, I know that is not an easy thing to ask in Scotland in December, but it does make a difference. And follow all of the advice on hand hygiene and cleaning surfaces. And please work from home if you can. If you were working from home at the start of the pandemic, please work from home now. And employers, if that was the case for your staff, please enable it to be the case now. But this is not a briefing any of you would have wanted to hear. It's certainly not one I wanted to deliver, especially not as we approach Christmas. Just as I am sure all of you long for the day you never have to see me or any of us at this podium again for a COVID briefing, let me assure you, I long never to have to do another COVID briefing again. But we face a really challenging period ahead again, and the only way through, and we know this from experience, is together with a shared understanding of what we need to do and a shared willingness to do it for our own sake and for the sake of all those around us. And a key thing to remember is that even with Omicron, we know the things we can do to make a difference. So please get vaccinated, test yourself regularly, and follow all of the other rules and guidelines. That will help us get through. Even with everything I've said today, I hope it will help us have a Christmas much more normal than last year, but above all, a Christmas that is safe and allows us to go into the new year still hoping for that better spring ahead. Thank you for bearing with me today. I know I've shared a lot of information with you there. We're going to go to questions now, and I'm going to ask Gregor and Jason to do more of the answering of the questions so they can share some of the expert advice that they have given me and I have shared with you. Firstly, Aileen Clark from the BBC.
Thank you, First Minister. Are you able to help the public by giving them a bit more guidance on what is meant by Christmas parties? Because, as you know, these will take different forms. It might be a lunch out in a restaurant with 6 people, and then they all go home afterwards, or it might be a big dinner dance, or it might be a trip to the pub. And given, what you've told us today, is it your position that you actually don't want people socialising at all with their workmates at the moment?
I'm trying to be proportionate and to be as clear. I really understand how difficult this is. We're focusing at the moment on work events for the reason that we know, and we've got examples already, as I've said, that these are resulting in quite rapid spread of this infection. That poses a risk to individual health, but as I said earlier on, that is posing a big risk to workplaces, whether they're in the private or the public sector. So that's why we're focusing on that at the moment. The bigger the event, the more those risks are very real. And dinner dances, for example, clearly with the number of people there pose a risk. But my advice would be to consider deferring Christmas events, work Christmas events. If they are small events that you wish to go ahead with, even notwithstanding what I've said there, then make sure you're testing yourself before you go, and everybody else in the group is testing yourself. As we have always done, we will try to put as much guidance around this as possible. We're in a rapidly evolving situation at the moment, and I have to make that clear. But we also have to rely, as we have done so well over the past 2 years now, we also have to rely on the good judgment and sense of the public as well. And, I have had every reason to have my confidence in the good judgment and sense of the majority of the Scottish population really strengthened over these past 2 years. So I'll give as much guidance as possible. But the reason I'm setting out the risks and the nature of those risks is to give you, the public, as much ability as possible to make sensible judgments. This is a variant that is and is going to, forgive the non-technical language, run riot through this not just Scottish population. Most of the cases will be mild, but the bigger the number, even a smaller percentage going into hospital is going to pose a real risk, and it will pose a risk. So let's all just be sensible, take precautions, and try to do everything we can to slow it down. Having said, I was going to give over to Gregor and Jason. I'm now going to do that, Gregor, and then if Jason's got anything to add.
Thanks, Effie. We've been witnessing a really quite remarkable rise in cases over particularly the last week. And one of the features of that in information that's coming through from the IMTs that are taking place up and down the country is the transmissibility of this particular variant between different people. And if we look at some of the incidents in detail, we're seeing attack rates for secondary infection, which are 70, 80, even 90% of people who come into contact with an infectious case actually coming down with Omicron infection themselves. So not only is it those who are contacts of those cases, but actually it's placing people at risk of infection themselves. And I think the key question for me that anyone should be asking themselves, particularly when it comes to going out or socialising with workplace colleagues, is if I do this and I come into contact with an infection, is it going to cause a problem for me, and is it going to cause a problem for those that I work with? Because I am in no doubt at all, with the type of infection rates that we are seeing just now, is becoming increasingly likely that we are going to be coming into contact with people who are either infectious because they're in the pre-symptomatic phase or have mild symptoms that they haven't even realised yet.
So 2 quick pieces of data I want to emphasise. Gregor's. So the attack rate is the percentage of people in the room who get it from a single index case. So if you have 100 people in a room and your attack rate is 50%, 50 people will be infected. And that's the order of attack rate we're seeing with Omicron, both here and a very good Spanish example that you may have seen in the media and some other examples from other parts of the world. Even higher attack rates in some places. So if you have a room of 100 people in a single unknown Omicron case is in that room, you could, in the days after that, find 50, 60 or 70 positives. That's what we're trying to prevent. The second is to emphasize one of the pieces of data that the First Minister gave. That is, if you have 3,000 cases a few days ago, that in approximate average terms is 90 admissions. So 3,000 cases is 90 admissions of Delta. Now, we don't know how many Omicron admissions you get from 3,000 Omicron cases. We think it's about the same. So if you have 9,000 Omicron cases, that's 270 admissions. That's 3 times higher just with an increase in the cases, even without an increase in the severity of the disease. That's what we're trying to prevent.
Thank you. Ewan Petrie from SCV.
Thank you, First Minister. Until late on yesterday, the advice continued to be to go ahead with Christmas parties, but with care. I'm just wondering what changed and why did this message come from Public Health Scotland rather than directly from the Scottish Government?
We're in a rapidly evolving situation, so I have to warn people that over the next few days, it may be that lots of advice will change very quickly. We are, Public Health Scotland is, Gregor and Jason, myself, advised by them, are analysing this data on a daily, probably more like an hourly basis at the moment. So as we learn about outbreaks that have come from known events and increasingly Christmas-related events and the attack rate from them, then we are changing our view and our judgment of the risk factor that is associated with these events. And that is just in the nature. We come back again. I don't know even at the outset of the pandemic whether we had a doubling rate of 2 days. Nope. This is a doubling rate of 2 days. This is a fast spreading variant. And we have to be as fast as it in our advice and in adapting, if necessary, our advice. And that is really difficult. Trust me, that is difficult for a decision maker. And I know it's even more difficult for those whose lives are affected by the decisions we are taking. Public Health Scotland, we're getting, as I understand it, queries from you and your colleagues in the media and gave their view publicly of the advice they were giving to the Scottish Government. And I'm saying today my view of that advice based on what we know. So I would ask people, probably this is, the most important time for me to be asking this since the start of this pandemic. Try and bear with us in terms of the changes that there might be to advice in days to come, because that will be based on our rapidly developing understanding of this virus. Duncan Beck from Border.
Thank you, First Minister. Following on from what Eileen asked you, with what we know about Omicron, what would you suggest is the safest way for people to be celebrating Christmas this year?
What we're saying, I've said what I've said today on work events and generally to people, and I'm not talking about Christmas Day or anything like that here in this answer, but generally just now, just be mindful of the numbers of contacts you're having that are not necessary. And I'm not talking there about your family or close network of friends, but just going into crowded places and coming into contact with people that you don't really need to, because as Gregor said, increasingly in the days to come, it is more and more likely that people you're coming into contact with might have the virus and might have the Omicron variant and might not know about it because they're not showing symptoms. And also, if you are going out and about, as everybody needs to do, I know that, test yourself. This test before you go, flow before you go, as some people are calling it, literally every time you leave the house to go somewhere that you're going to be coming into contact with others, test yourself. And that means that if you've got the virus, you can say, well, don't go and you shouldn't go. But it also gives you a bit of confidence that you're not passing it on if the test is negative. And if you're going to meet friends for a coffee, say to them, look, have you done a test, so that you're all protecting yourself? These are these are devices we didn't really have to the same extent this time last year. So while this is a grim sounding scenario I'm setting out today, I don't deny that we have tools in the toolbox that we didn't have before. So for goodness sake, let's all make sure we're using them to full effect.
Testing is our biggest ally just now, I have to say, because we know from the preliminary investigations that are underway just now, the lateral flow devices are effective at picking up Omicron. So just getting into that regular habit of making sure that if we're going to be in contact with others from outside of our household, is that we're making sure that we're testing regularly. Partly that safeguards those that we're coming into contact with, but it also allows us to know very quickly if we should be isolating and preventing that further spread across society. This is the best way that we can limit and contain the spread of Omicron at this moment in time, is to make sure that we're detecting these cases as early in the process as possible. And by doing that using lateral flow tests, we're going to have a high reliability of being able to come across these cases before they have the ability to be able to pass on to other people.
Jack Foster from Global.
Good afternoon, First Minister. Almost 2 years on from the first cases of COVID, I'm sure most of us who've been out speaking to people will have noticed a shift in how people react to these sorts of developments, asking if what if there's another variant, what if there's another spike, what if this never stops? Are we going to be stuck in a cycle of this for the rest of our lives? And I know that you've said in the past when posing such questions that we shouldn't be glib about human life, but there are, of course, many often forgotten casualties of the past couple of years who didn't necessarily catch COVID, but diagnosed with terminal illnesses too late, maybe took their own life due to depression, loneliness, stress, or who just couldn't access the help they needed because of backlogs due to staff working from home or reduced numbers in appointments and so on. So obviously the very real dangers of Omicron to one side, it is also for all of these reasons, not just missing out on socializing, but lots of people are absolutely terrified when they hear talk about a return to possibly stricter COVID rules. I wonder what you would say to those people to put their minds at ease just now.
I understand it. I share it. I can't, I can't begin to find the words to express the level of despondency I feel right now at this. I made a statement in Parliament 2 weeks ago, the day we decided on balance not to extend the COVID certification scheme because cases were really starting to look as if they were on a downward trend. And we knew there were risks over Christmas, but even taking that into account, we thought we were in probably a better place than we'd been for a long, long time. And I felt that day a greater sense of optimism than I had for a long time. Within 48 hours, I'd heard about the emergence of Omicron, and that all changed. So I feel that despondency. I feel that anxiety. I feel that sense of fear of going back the way, although I really hope, and I'm not suggesting for a minute we're going back to where we were at the start of the pandemic in terms of restrictions that were in place. So what I would say, and I don't know that it eases people's concerns, but I hope it helps people understand, because often what flows from the very legitimate question you've just put to me there is, well, just let the thing happen. And I understand where that sentiment comes from. But the point I'm trying to make today, because I know how much harm in other ways any restrictions cause. But if we take the other option of just letting it happen, the key point here that I'm really trying to ask people to understand is that all that harm will happen anyway. It will just happen in a much less managed way, because the sheer weight of infections, that arithmetic point, will overwhelm the National Health Service. And at the very least will mean that the National Health Service has to stop doing non-COVID work again. So that harm happens. It will disable and paralyse workplaces because people will be off sick. We're already seeing that today. The sickness absence in key services already starting to bite. So we'll see services being interrupted in that way. So when you're faced with something like this, it's not, is there a way that just avoids all of this impact? Believe me, if there was, I'd be grabbing it with both hands. But there's not. There's how do you manage the impact in a way that overall minimises that harm? None of that takes away the fact that we're 2 years into this and it's very different and people have suffered and the accumulated harms are very real and a real worry. And I know all of that. All I can do, to the best of my ability, it's what I've tried to do since day one, is navigate us through this in the best way possible. I can't magic away at what we're dealing with, but navigate us through it in the best way possible to try to overall keep the harms to a minimum. I don't expect that to have eased anybody's anxieties, but I'm trying to level with people and set out as clearly as I can just the nature of the challenge we're dealing with.
I would only add one thing, and it's the framing you used, Jack. These are not forgotten harms. These are very, very prominent harms. The conversations that Gregor and I have with the First Minister are not just about COVID harm. They're about broad public health harm. And that comes from work, that comes from business loss, that comes from unemployment, it comes from mental health. And we have a host of other advisors, including economic and social policy advisors, that feed into the decision makers to try, as the First Minister articulates, to manoeuvre through this enormously difficult challenge. And if there were a harm-free path, some country would have found it, and we would be very, very happy to follow it. There is not a harm-free path. You have to just tread the tightrope, and that's what we're trying to do.
Callum McQuaid from Bauer.
Thank you, First Minister. Yesterday, your Finance Secretary, Kate Forbes, was calling on support from Westminster for the hospitality sector, now that they will be faced with Christmas cancellations. If businesses do get that support, how likely are you to reintroduce restrictions on this sector and their operating hours?
Reintroducing restrictions will be a last resort. It's not a case of if we get financial support, we're just going to go health. We will only introduce restrictions and protections, actually, because they're about protecting people, if we think they are really necessary. Obviously, even asking today for people to think about deferring work Christmas parties has an impact on hospitality. So we know that we need to try and find ways of supporting hospitality the way UK funding arrangements work. We don't hold the borrowing powers, the UK Treasury does. So we need to look to them to activate that. And they're going to be facing these issues as well. What I'm talking about here today is replicated across the UK. There'll be a Four Nations discussion this afternoon. And again, I'm sure I won't be the only leader of a nation within the UK that is making this point. Neil Pooran from PA.
Thanks, First Minister. What's the impact of Omicron on hospitals expected to be? Do you think they'll need further support beyond what you've announced already? And earlier, the Health Secretary said there were particular issues with delayed discharges, bed blocking in Edinburgh. Is this being resolved, and will this add to pressure in hospitals and Lothians?
Okay, do you want to talk about the issue in general, and Lothian if you want?
Jason, I want to come in on this as well, but clearly, Neil, this is something which we're keeping a very close eye on just now. When you look at the projected rise in cases that we're seeing just now, and there will be an associated knock-on effect, which will probably be delayed by 2 to 3 weeks after that rise in cases of hospital admissions. The extent of that is yet unknown, but with the size of wave that we can start to see shaping up here just now, there's no doubt in my mind that we're going to see a rise in hospital admissions that will come with that as well. So with that in mind, there are daily conversations with hospital leaders across the system, both clinical leaders and also the management teams, as to how we respond to that, making sure that there's enough resilience within the system to cope with that. And that might mean some reconfiguration of pathways and services to make sure that we can optimise staff where they're going to be needed most during that time. It's really important that as part of that, we're making sure that the wide variety of health conditions that we see at this time of year, because remember, we're entering a winter period where there are many other conditions which start to rise as well, but we need to make sure that those are all catered for as well. And the work that's underway just now and is being done makes sure that that's going to be the case. Jason.
Well, there's two simultaneous problems happening. There's the problem that Gregor illustrates, which is the number of people with COVID who may come in the tsunami of cases that are arriving. And then there's also the self-isolation of health and social care staff. That's another reason to try and reduce the numbers of this particular variant, because we need people to be at their work, to drive the trains, to fix the electricity supply, and to care for us in our hospitals, our GP practices, and our care homes. So there are two simultaneous reasons to try and reduce the harm from this particular variant. And that's why you hear us being a little bit more sombre than you had hoped today.
Kate Foster for the Daily Mail.
Thanks, First Minister. You've said that you can't rule out any further measures in the next few days. People are planning their Christmases and New Year's now, just in terms of social gatherings at home. Are you saying that you might bring in some restrictions that might mean that they have to change those plans?
No, I'm not saying that today. I'm just trying to be candid with people. I would ask you, Kate, to sort of just reflect on what we said earlier on just now. We're dealing with a variant of this virus that is, the cases are doubling, we think, every 2 days. So it is rapidly evolving. I hope that what we already have in place with protections, I hope that what we're advising people today around the changes to self-isolation of household contacts that I've spoken about, and the advice we're giving people about work events and just generally trying to be careful about unnecessary contacts will help to drive this in a better direction. And that's, if we all make a really concerted effort, I hope that is the case. I really, hope, and I said it in my opening remarks, that we will have a much more normal Christmas. But this is horrendously difficult to stand here and look down this camera and say some of these things. Given what I've said here today, I can't, and I'm not going to treat the population as if they don't have the intelligence to understand this. We need to take this day at a time just now. But part of what I'm asking people to do is to try, if at all possible, to protect the normality of Christmas that we're all trying to have, and I, as much as anybody else, is looking forward to. So hopefully, if we do all of the things I'm talking about today, we minimise the need for further restrictions down the line. Dan Vevers from The Sun.
Thank you, First Minister. You've indicated there might need to be some restrictions reimposed, and there's a cabinet meeting on Tuesday to look at this. Can I just ask what specific measures you're considering, if necessary, and could it mean, for example, capacity being reduced at big events like football games? And could I also ask, is there any evidence yet on how Omicron was seeded into Scotland? Should we have been more careful with our border control measures, or was this kind of inevitable?
Well, I'll ask Gregor or Jason to answer that point. No, I'm not going to tell you what Cabinet might consider on Tuesday, because I don't know yet, because this will depend on the continuing analysis of the data. I'm really, really mindful that 2 years in, if we're asking the public to do anything else, we've got to think very carefully. Is it the right thing? Is it the thing that is likely to have the biggest impact? And that means, thinking very carefully, not just coming out with things because we can, but we really look at the data, anything that we might ask people to do, and judge whether that's going to have an impact. I would also just repeat again, doubling time of 2 days. Tuesday, in that context, is a long way away. We will be monitoring this data literally every single day between now and then. Which one of you wants to come in on this?
I'm happy to take this. I mean, at this moment in time, we don't know where the first case came from, but we can speculate that it's likely to have come from one of the southern African countries. The first cases that we recorded in Scotland were from testing and an event which probably took place on or around the 20th of November. So what we can say is that at that point in time, there was certainly evidence of Omicron being in this country. The exact source of it is at this stage completely unknown, but I think that that's academic in the context of this particular variant that we're speaking about here. You asked whether it was inevitable that we would see this coming into the country. I think it's inevitable that we will see this particular variant spread right around the world in the same way that Delta has done beforehand. The reason for that is the transmissibility of it more than anything else. By the time we even knew of its existence, it had probably spread and seeded in multiple countries across the world. Certainly that's what the evidence begins to suggest. In terms of travel restrictions, I think that they do help to reduce the likelihood of the speed of the wave that comes into the country. It's really important to be able to do that so that contact tracing teams can begin to slow that down and we can prepare for it. But if it's inevitable that at some point in the lifespan that we'd have come across Omicron, yes, I think it's absolutely inevitable it would have happened at some point.
Tom Martin from the Daily Express.
Hi, good afternoon. Thank you, First Minister. Just returning to the point about potential further restrictions, given what you've said about it being virtually certain that we're going to see a surge in cases, does it not make it inevitable that we are going to have to see some form of further restrictions in the coming weeks? And if I could just return to Kate's question about household gatherings, that was one of the first sort of tools in the toolbox in earlier stages of the pandemic. Are you having to give active consideration to limits on social gatherings in people's homes?
I know, and I understand why. So it's I'm not having a go at you here, Tom. You're trying to put words in my mouth. I'm choosing the words that I'm choosing today because this is really serious, and I don't want to be misinterpreted for the sake of a headline. In terms of what I've said, you can read back what I've said. I'm not going to sort of rephrase that in a way that might be more conducive to a headline. It's too important for that. On household, look, generally, unless we tell you or ask you rather not to do something, you can continue to do it, but do it safely. Test yourself before you do it. Get your vaccines. Follow all the hygiene and ventilation advice. So that's a kind of principle to work on just now. If we think something really needs to stop happening, we will tell you that and ask you and set out why. Until then, do what you're doing, but do it safely. And remember all of the advice that we are currently giving. Do you want to add anything, Jason?
No.
Okay. That's unusual.
Welcome.
Dan Sanderson from The Telegraph.
Hi, thanks, First Minister. We've seen guidance which has been shared with parents of school children in the Edinburgh area this morning. And it basically says whole classes are going to will be classed as a close contact. If one child in that class has Omicron, those children will then have to isolate for a full 10 days, even if they test negative. Can you just first of all confirm whether this is the same across the country? And also, given what you said about how prevalent this is going to be, isn't it just going to lead to sort of thousands of children effectively being put into lockdown, potentially repeatedly, even if they don't have COVID, and that schools are effectively going to be shut by the back door? And also, by using such a strict definition of what's a close contact, how can you justify children once again being treated more harshly than the rest of society? Thanks.
Well, firstly, they're not. I'm not going to comment on guidance because I'm not sure whether it's guidance I've seen. It may well be, but I set out in my opening remarks what we were going to be asking for in terms of isolation of household contacts from tomorrow, and that includes children within households. So that's set out there, and if that is guidance that is reflecting that, then that applies not just to children, that applies to adults as well. But the point I would make here, it comes back, I can't remember who asked the point, I think it might have been Jack Foster earlier on about, if you do this, you're just going to cause all of these problems. Wouldn't it be better just not to do it? And it comes back to this point, if we don't do it, so what we're trying to do here, a driving objective of mine, and I want to look down the camera and say that with every fibre of my being, is to avoid schools having to close again, any kind of blanket closure of schools. Children have suffered too much. We need to keep schools open at all costs. And if that means adults doing more, that's what we should do. But if there are cases in schools, then isolating groups of children is actually about trying to keep the school open overall. Because if you don't isolate the groups of children where there is an infection, the danger is you end up with all of these kids off sick anyway. So the school effectively, that's how you end up closing schools by the back door. I come back to the point, none of this is easy. None of this is what any of us want, but this is not a case of we're doing all these things and it's all terribly difficult and do we really need to do it? Can we not just let the whole thing, run through? That's not how it works. There's going to be impacts here. If we try to manage those impacts, we hopefully minimize them. If we just let them go, then they will be much greater and much more damaging than they will be otherwise. Mike Wade from the Times.
Can I just double check? This update says it seems to suggest there's been updated guidance from Test and Protect, and obviously the sort of definition of what was a close contact in school was changed and relaxed. Has that position changed for Omicron?
I don't know if you listen to what I said at the outset. I set out the change to isolation policy for household contacts, and that will affect children in households. Beyond that, I'm not going to comment on a bit of paper you're looking at that I'm not looking at. I'm happy to do it afterwards when I've had the chance to see it. But if it is something that is reflecting what I have set out today, then yes, that is what it is reflecting. I have proactively set out a change in isolation policy. So I would ask you to listen to that. If that's what it's reflecting, fine. If it's something else that I've not seen, I'm happy to comment on it when I've had the opportunity to see it. Helen McCardle from the Herald.
Hi, afternoon, First Minister. I was just wondering, given that vaccine passports or the expansion of vaccine passports had been on the table fairly recently, and given the situation we're now in, I just wondered why at this stage we're not maybe expanding the vaccine passports to more venues and maybe making them tougher in terms of having a requirement for vaccination and a negative lateral flow at the same time.
Helen, there are many things that are under consideration. I'm not going to single out one today because we have a process of consideration that we will need to do over the period, but we've considered extension of COVID certification before. We, for reasons we set out at the time, didn't do that. It will be one of the things that we consider as we further think through how we best respond to this in the days to come. Jane Bradley from the Scotsman.
Thank you, First Minister. Just going back to the question about schools, I know you said you want to avoid a blanket closure, as much as possible. But if you're looking at an attack rate of 50% and you've got, one child in a class with COVID, are we not inevitably going to be looking at mass closures of classes, mass closures of schools, and potentially a return to home learning?
Look, we're seeing already, I can't stand here and say that no class will be disrupted, that no school may have periods of disruption. What I'm talking about here is what we had before, which is the blanket schools are closed. Nobody wants that. I will bust a gut and do whatever, even if people hate me for asking adults to do more than they want to do, to keep schools open in that general sense. Of course, if there are outbreaks of infection in schools, then there needs to be a response to that. But I'm very clear about the importance of minimising the disruption to children's education. And lastly, Kelly Wilson from the P&J.
Good afternoon, First Minister. What's your response to claims made by Russell Borthwick, the Chief Executive of Aberdeen Grampian and Chamber of Commerce, that illness and pressure on the NHS happens every year this time of the year, and that Public Health Scotland should ensure the NHS has sufficient bed capacity and not risk businesses and jobs by advising delays to Christmas parties?
I'm going to do Russell the courtesy of saying I haven't read his comments, and I'd be surprised if his comments were that unnuanced. Anybody who thinks that what we see in terms of pressure in the NHS from a global pandemic of an infectious virus is the same as what we see every year, I find it hard to believe that anybody would make that statement. It's just not true. What we are seeing and what we might see in terms of pressure in the NHS coming from this is of an order of magnitude bigger than what we would see in a normal year. And you cannot staff a health service in normal times to always be at the level it would need to deal with a global pandemic. I mean, clearly. So as I say, I suspect there might be slightly more nuance to Russell's comments than that. But if that is the case, then that is just manifestly not true. Sorry, I think I missed Mike Wade from the Times, so I will lastly go back to Mike.
Hi, First Minister, thanks. Given what Gregor Smith said about travel restrictions, and given the data that you brought to us this morning shows that Omicron is very much more prevalent in Glasgow and Lanarkshire than everywhere else, shouldn't you be considering travel restrictions of the type that we saw earlier in the pandemic?
No, that wouldn't be a judgment at the moment. I mean, you'll see a bigger number in Glasgow and Lanarkshire, partly because of bigger populations there, and the nature of the populations will lead to greater growth. But we're seeing I think we've got cases in every health board area in Scotland now, including our island health board areas. This is a pan-Scotland, it's a pan-UK transmission of this virus. I've not hesitated in the past if I thought regional travel restrictions could help stem spread from one area to another, but I don't think that is the situation we're in just now. But happy to allow either of the advisors.
Other than to say that we're seeing community transmission right across Scotland just now. It's not distinct to just the Central Belt, just to Lanarkshire or to Glasgow. We're seeing it right across the mainland and even into some of the islands just now. So travel restrictions at this moment in time don't have a part to play.
Thanks very much. That concludes the questions today. For those who've managed to join today, thank you for doing so. We've shared this with you today, and I know we've done it deliberately in a very unvarnished way, not just to although this is important to share that understanding of the context of decisions that we might have to make in future, which will be decisions, if we have to make them, that nobody wants to make and nobody wants to have to live with the impact of. But the other reason for sharing this right now is to really underline that none of us are powerless. We can all, through the things that we are being asked to do now, hopefully make a difference in this. So that's my parting plea, really, is just remember and please step up compliance with all of that. Get vaccinated, test yourself every time you're going somewhere, wash your hands, your surfaces, wear your face covering, open the windows if you can. These things will make a difference, and the more all of us do them, then the more chance we have, not of magicking this away, but of getting through it with an impact that is more minimal than might otherwise be the case. So thank you very much for joining us. I will, of course, keep you updated in the days to come, including, if necessary, which I hope it won't be, but if so, over the weekend. But in the meantime, thanks for joining us.